Preparing an inspection is a bit like preparing a meal. You prepare a meal for various reasons, just for lunch or dinner as usual, and sometimes for special occasions, to surprise like in anniversaries, birthdays, and celebrations.
And like in preparing a meal, as an inspector, you also have various reasons to do an inspection.
Routine inspections are like you're preparing lunch or dinner, but there could also be reasons triggering you to inspect, just like preparing a special cake for a birthday celebration.
So, depending on the reasons, you may or may not announce the inspection. If you are going to announce, this should be done a few weeks prior to the inspection.
Secondly, like for any recipe, you have to gather all the ingredients. In the case of an inspection, the ingredients are all of the relevant documents, starting with the approved and final version of the study protocol, the investigator's brochure, the information leaflet, consent forms, case report forms, patient data listings, signed agreements between involved parties, such as the investigator and the CRO, or between the investigator and sponsor. And at this point, regulatory approval documents need to be cross-checked, since they will tell you which version of the protocol and informed consent are approved. All of these documents need to be reviewed beforehand. You will also need reports from your regulatory authority of past inspections and inspection reports from other regulatory authorities if they are available. And these are very useful because they may flag potential issues and items that need to be verified.
So just as you may cook alone, sometimes it is more of a team effort, like someone will be peeling the onions while the other person is chopping the vegetables.
You always have a team of inspectors, and in this sense, you need to define the roles of each inspector
And agree on who will be the leading one, like who is the chef cook.
The documents you gathered should be shared with your co-inspectors, and you should agree with them who will review what. Finally, you should ensure that you have a blank inspection template on hand. Thirdly, you draft the inspection plan. The plan is a bit like a recipe that tells you and your co-inspectors and the inspected company what to do and when. The inspection plan needs to take into consideration the weaknesses at the site that you saw from the information that you reviewed, and it should also include an allocation of tasks to each different inspector. If it is an announced inspection, it will help the company to ensure the availability of the necessary people at the site and will allow also for all the source documents to be retrieved from the archives on time.
Fourthly, there are certain documents or information you may need to ask the site either to send to you or to prepare them for your review upon arrival.
For example, information on how many subjects so far have been recruited and the progress of the trial.
Finally, you need to come up with specific questions you would like to ask.
No matter how many times you have conducted inspections before, never go to a site without a list of questions. You also need to practice your questioning skills, as these will be the determining factor in getting information effectively from the persons that you interview.
And please do not forget to prepare yourself for what you will be saying at the opening meeting.
In conclusion, if you want your meal to taste good, you need to follow certain rules. And in inspections, quality preparation is the key for an effective and successful inspection. You must review all the documents available and have the greater picture in detail so you can focus on the highest risk areas at the site you're inspecting.
This is the only way you can make sure that the research team is complying with GCP principles in order to protect the rights, safety, and well-being of the patients.